No. Oh, yeah. Okay.
Okay.
We're on.
We're off. Okay, we finally made it.
Few technical
Hello.
issues, but we're here.
Yes, yes. I mean, I've posted online, so hopefully people can join, but if they don't worry. So if you need to check in who's coming in or out, don't worry about
Yeah,
it.
that's fine.
But I think we kind of crack on, right? Shall we start?
Yes, absolutely.
So hello, everyone. Hope you're seeing this and hope you manage to get something out of it. I'm Anna Maria, for anyone who hasn't met me yet. And today we're really excited to talk about something with my amazing friend Katie, who I've only, funny story, met today. But we've spoken a lot and we've attended a boot camp online and we decided we should collaborate together. So here we are. So, well, Katie had a brainwave, which really made sense. And this October is Osteoporosis Awareness Month. So, of course, I've been posting a lot about osteoporosis. So we said, why not do something that people think only happens later on in life when it actually happens, the foundations of it happens much before. So we said we'll do this together. And basically what we're going to cover is we're going to go through what osteoporosis is. So I'll just explain briefly in simple terms what you get when you have osteoporosis and what's the most common things that predispose you to having osteoporosis and developing it. And then we'll go through, Katie will speak about how pregnancy and the postnatal phase have a play on bone health later on. And then we shift on speaking to what you can do and like what strengthening things you can do and why Pilates helps and what's the things that you really need to focus on. So, hi Katie, first of all.
Hello.
Hello. So, right, is that sounding okay for you?
Sounds brilliant.
So let's start. So I'm going to just go through what osteoporosis is. So basically, it's a condition where bones lose strength, and the amount of bone tissue that you get left in the bones becomes less and it becomes weaker. And that makes a combination of your bones being more fragile, and you're more likely to have a breakage from simple things. Like we get people coming like a misstepping over a pavement or just bending forwards. That doesn't mean that if you have osteoporosis, these things will happen, but the bones aren't structurally sound to withstand those types of forces when you have it. So when you look at the bone, like microscopic level, what happens is there is a disruption of balance within the bone. So normally within a healthy bone, we've got this dynamic of a cycle where bones which are old are being absorbed and new bones are being laid. When you have osteoporosis, this dynamic cycle doesn't happen. And most of the time, the old bone is absorbed. We call it resorption, but the new bone doesn't form. So you end up with, if you take a scan, you end up with a bone which looks a bit bigger, but actually is thinner inside. So you've got the outer layer, which becomes a little bit thin, and the inside looks like a sponge, basically. So architecturally, this is not a very strong bone. So any forces that you would normally withhold during the day will be the same on the bone, but the bone will withstand them less. So with osteoporosis, we call risk factors. So there are risk factors that are things that will make you develop osteoporosis more or less likely. They are split into two. So you've got the things that you can't control, like your sex, your genetic, your race, your whether you have early menopause or late menopause, and those are the things you can't change. So potentially, we're sorry, but we can't help you with that. But the things that you can help with are what we call modifiable factors. So things like your physical activity, your level of physical activity, which is really important. Your calcium and vitamin D intake, that is what your GP will normally prescribe and help you with. And lifestyle things like smoking, sleep habits, and of course, your weight. And then, of course, hormonal things, hormonal and changes and things that happen during pregnancy. Those you can't really change. Even if you're not pregnant or you don't have children, these hormonal changes happen. So, say you'd have some issues, gynecological issues, and these matter with your hormones, and this ties into making sure that you have the right treatment and approach the right people, basically. So, as in risk factors, as I said, there are things we can change and things we can't. So we were going to focus on things you can change. Now, when you look at how common this is, and this will lead us on to the next bit, globally, there's about 18.3%. So these are the figures I found recently. 18.3% of the whole population that was covered. So this was taken as a percentage covering ages from 15 to 100 years. So this gives you a big age range, showing you that the baseline of it is not actually very old. It's 15 years of age. And that's the amount of people which have been reported to have osteoporosis. Amongst them, the prevalence is higher in women as opposed to men. And that ties in with the fact that we do have more changes in hormones and changes in our body composition as we go through our lives, and we can't change that. And there is a little bit more of a prevalence in with regions and countries. So, for example, it ties into diet and level of activity as well. So I feel like Malta has a little bit higher rate of osteoporosis than probably the UK. But then, of course, the UK has a significant amount because of the lack of vitamin D. So there are things that obviously depends on the region is more prevalent than others. But technically speaking, even though we say that it is more common in older generation and the women, when you look at the facts, like it's one in 4 women and 1 in 10 men globally that people get and develop osteoporosis. So actually, even if we look at the age range that we said before, it's not an old age issue. It's actually a widespread kind of issue. And so when we look at this, we're saying like, listen, osteoporosis is actually not something that affects only older women, but it actually affects much younger generation as well. And this ties into the truth of the fact that we need to have foundations laid much earlier on to have healthy bones later on in life. And so what really happens during the earlier stages of our lives, whether that is pregnancy, the postnatal period, or any changes in hormones in our lives, really influence the bone tissue and the way it shows up later on in our lives. So I'm going to pass it on to Katie now, so she can give you a little bit of an insight on what happens, or what are the risk factors or the things that happens during pregnancy in the postnatal period that will affect bone health later on.
Brilliant, thank you. So, yeah, I'm Katie, a MSK and pelvic health physio. So, like Anna's just said, and actually what you've just said is exactly right. It's the foundations. And so when I put my poll out, a lot of people thought that it did just affect older people. And yes, so I think, so the statistics, I think that I found that it does affect older people more, definitely. 2% of women in their 50s develop osteoporosis, but 25% when they're 80s. But it's exactly what you said. It's the foundations that we're building in those early years to then protect us as we get older, to stop us being that 1 in 25%. And we're not talking about the menopause today, but after the menopause, your estrogen drops significantly, which is one of the reasons why we develop osteoporosis. And women who have much earlier menopause are more likely to develop osteoporosis because their time of lower estrogen is effectively longer. And that time to and those kind of the first 10 years post menopause are the time when the bone density drops the most. And that's kind of the time that you need to really, really focus on protecting that bone density. And then, so it's a big steep drop in the first 10 years after menopause. And then after that, it continues to drop, but at a more gradual rate. So exactly like, as you said, it's the foundations that we're building in that kind of mid-age and earlier age as well to protect the bone density. So moving on to pregnancy-associated osteoporosis. So a lot of people have never heard of it, and quite rightly so, because it's an ultra rare disease. And actually, it's it the, oh, sorry.
It's okay.
Dropped my phone. Sorry, my phone just fell. So, and actually, it doesn't necessarily correlate to osteoporosis itself. We have absolutely no idea why people get it. There are a couple of hypotheses, but at the moment, we're unsure. And during pregnancy, our bone density decreases. And especially in the third trimester, the bone density in the third trimester decreases quite a lot. But then when we have the baby, the bone density returns. And it doesn't correlate with the bone density of and the fractures of osteoporosis. Of pregnancy associated osteoporosis. So the level of bone density when the bone density drops in pregnancy isn't enough to cause the fractures that pregnancy associated osteoporosis causes, if that makes sense. It's completely normal for that bone density to drop in pregnancy, but it's different to the level that it drops in pregnancy associated osteoporosis. Similarly, when we breastfeed, our bone density is low, but then when our hormones recalibrate and we stop breastfeeding, our bone density returns to normal, whereas it doesn't in pregnancy associated osteoporosis. So it's different. Pregnancy associated osteoporosis tends to come in when you're pregnant, or within that fourth trimester, so within 12 weeks afterwards. And it's really, really, really difficult to diagnose. And partly because it's so rare, and partly because when women are pregnant, they have terrible back pain sometimes, and it's really difficult for them to get to diagnosis. I've had, since we've shared about doing the live today, I've had a couple of people message me saying either one person has had it themselves and it took 6 months for it to be diagnosed. And then I had another lady who said a friend had it and she had 4 vertebrae fractured. And it took a long time for her to be diagnosed. It is really, really difficult for it to be diagnosed because it could be a multitude of anything. So the things that you're kind of looking for it, like when if to understand whether it is or isn't, is severe back pain. As it tends to be, it's most common in your back, or in your pelvis, or and slightly less common in the hip. So a change in height, so where your vertebrae reduces from the fractures, and also severe pain in the back. It tends to. So we were talking about how prevalent osteoporosis is in general, but POA tends to be what the figures that are out there are between 1 in 50,000 and 1 in 100,000, which is extremely rare. But actually, we're thinking it is a bit more than that. We just haven't got the figures. And like I say, the misdiagnosis from it. And there's lots of research going on at the moment in Edinburgh about it, and obviously with the Royal Society of Osteoporosis as well.
No, this is very interesting. Of course, it's very hard to diagnose, but yes, I would say, like, if it's not pregnancy related for us, usually we get, like, I'm trying to remember a few cases we had, like someone with severe back pain to the point where, like, they're fine lying down, but when they're upright, it's really painful to stay upright. And normally it's traumatic. So there would have been something that happened, like, but not a very big trauma. So like not a pure big fall, but like recently we had a lady coming in and she just, because something that they do here a lot, she flipped the mattress because she didn't want to stay on the same side of the mattress. So she flipped it, and since then she thought it was a muscular strain, and only an X-ray showed that she had a collapsed vertebra.
Yeah.
And she had an underlying osteoporosis diagnosis. So yes, those are the kind of things. So of course, if they're pregnant, you can't scan them, so it's really hard to diagnose. But
Exactly.
postnatally, equally so, they'd probably put it down to holding the baby for a very long time, or like doing new things, your body adapting. So yes, I suppose that is why it's not as common, because it's very hard to diagnose as well.
Exactly. And actually, that's then we're missing people who do have it as well.
Yes, yes.
And so,
Okay, so
so the treatment, moving on to the
mhm.
treatment then. So, obviously, to make, and you touched on vitamin D earlier. So, to make, obviously, making sure that your vitamin D levels are high enough, your calcium levels are high enough. And in, so I'm not sure about Malta, but in the UK in the summer, you will only absorb vitamin D from the sun between April and September. So the rest of the time, you need to make sure that you're supplementing for
Mm,
vitamin D if your vitamin D levels are low. And
mhm.
then obviously, load bearing exercises help with bone density. And obviously, if you've got a diagnosis of osteoporosis, then this needs to be built slowly and through a trained professional. But you shouldn't shy away from doing load bearing exercises. And this is where it comes into Pilates, which both you and I are a huge advocate for.
Yes, yes. Well, to be fair, you mentioned the Royal Osteoporosis Society before. Their motto or their framework goes into strong, steady, and straight. Yes, strong, steady, and straight. So there's three S's. So they're all about weight training and balance training and posture. And the reason why it's so important to load your bones is because of that absorption, reabsorption kind of dynamic cycle that happens, that it's already low when you have osteoporosis. So the only way that has been proven research wise that there is bone regeneration happening is if you load bones. Bones need
Yeah,
loading to generate. Similarly, as when you're treating tendons like these soft tissue on your hands, they need load. Now, when the thing is that I know that there are certain people who have a level of osteoporosis, they might not be able to progressively load with weight. Or and so when we're talking about loading, we're talking about things like, so one of the questions I had was, yes, okay, loading is important, but is walking loading? What happens when you load? So as I said, you've got bone regeneration, but you've also got the contraction of the muscles that pull on the bone itself, the contraction relaxation of the muscle that pull on the bone itself through the tendon, and those forces help to also load the bone and regenerate bone. So we're not talking about jumping yet, although if you see the program of the Royal Osteoporosis Society, they take you from stamping to actually jumping if
yeah,
you are okay. So there is jumping when someone has osteoporosis. Just obviously you need to see the level that you're at, to be fair. You're not going to go from zero to jumping. And so yes, loading is important. And what we do in Pilates, it's a lot of the three S's. So we're not properly strength training, but we are training and strengthening our muscles in a different way. So we're using to aim to fatigue to the point where your muscles are fatiguing, but through high repetition and some level of resistance. So you, like recently, APPI have gotten out the reformer for osteoporosis. And reformer is a type of Pilates done on a machine. And that is, they include actual loading exercises through the springboard. And so that's Pilates. If you wanted to do loading, that's one of them. And then there's Pilates that we do mat work style. And there we focus on your posture, strengthening the muscles around the spine to help support your skeletal system. You build muscles around the hip to actually help support the areas around the most vulnerable parts. So another question we had sent in was which bones are mostly at risk? And usually we're talking about the hips, the wrists, and the spine. And again, like with the wrists, like things we do in the postnatal classes and in the postnatal period, and even in the Pilates scenario, we do 4-point kneeling. So we load our wrists. And that's a way of getting our wrists stronger. We as women tend to have really weak wrists, but obviously we need to load them. And there's some level of discomfort, but the more repetition you do it, the better it becomes, and the bones get stronger through load. So yes, loading is important. So it's a mix of Pilates, I would say, and strength. There's also many studies coming from Australia. The Liftmore study is not new. It's quite common now. It's quite old now, but they use deadlifts, they use heavy weights, and they've proven that there was an increase in the decrease in the bone density and increase in the strength of the bone. But what is really, really important is that if you've never done exercise before and you have been diagnosed with osteoporosis, is that you seek professional advice first, get the guidance, get the medical treatment that you need if you need it, and then take it from there. So this is why we're here. We're talking about it because, of course, we can guide you safely and we know what you can try and avoid. So,
And
like, no, go
no,
ahead.
I was just going to say, following on from that, so and talking about strength training, so it's
Yeah.
ladies who are in their postpartum period, and if they've had a significant birth injury, so they have a significant prolapse or a significant tear or an infection, and actually we've slowed down their weight training for now, and until we can get the pelvic floor strength and their symptoms back in check, then yeah, our aim is that we're getting these women back to strength training quite quickly. But in that initial period when their bone density is lower, because of they've just had a baby, and their bone density is lower, the time that it's going to take to then rebuild that can be slower, and they can be then because we're slowing them down from a weight training point of view because of their other symptoms. So that can have a significant effect on women as well. So from every part, from the bone density point of view, from their birth trauma symptom point of view, we want to get them back to strength training, but it just can be a bit slower.
Yes, of course. And to be fair, this is why Pilates, and this is why I love Pilates, and probably would going to say the same, because I had a traumatic birth where I had an emergency C-section and I couldn't weight train for a very long time because obviously my body needed to heal. It was a major surgery, so I couldn't. But what I could do very early on are my pelvic floor exercises, the very gentle level 1 exercises of Pilates, really just building that small foundations that I could still load, I could still do 4-point kneeling exercises, I could still do some level of strength training, but you don't need to stay waiting like 6 to 8 weeks before you start something. You can always start something early on. And that's actually very important because at least it gets you there earlier.
Mm-hmm. Definitely. And as I said, it's tailoring the exercises to you and what you need from it and your history and what you've just been through as well.
Exactly. Yes, I 100% agree. Let me just see if I had another question. Okay, yes. So one of the questions was, is it safe to do loading exercises or impact work if I'm postnatal, or even if I know if I have low bone density? We've talked about this, but I think there was one thing that we talked about before was if they had a prolapse, and that obviously stops them from loading too much. But they can still do the early on exercises.
So it's more about their symptoms and it's the same with the diastasis. Like it's about their symptoms and helping to build up the strength whilst keeping their symptoms under control. And you may never fix the prolapse fully, but it's the symptoms that we really focus on, and being able to manage that pressure whilst loading. And that is what we want to get back to quickly, and obviously safely, but we want to get back as quick as possible to them loading weight whilst managing their symptoms and keeping that pressure under control.
Yes, yes. And I think one of the things that I also wanted to mention, which is not here, but I feel like it's a really key point as well, going back to the modifiable key factors. So I know one of the things that we can modify, and it's something that is obviously impacting when you just had a baby as well, is lifestyle and sleep and healthy habits. So I'm speaking to, and I know some of the people will be coming to my postnatal class as well. So them attending to the class, we focus a lot on, when you're doing Pilates, it's mind-body connection, taking that time to build that connection again with your mind and your body and what's doing now after having a baby, breathing control, and all of these things, and actual exercise that we know helps actually with sleep and improves endorphins and helps you to relax and everything. So I feel like even doing these exercises early on and Pilates-based exercises will impact indirectly at this point, even postnatally, or say even if it's not postnatally, but later on, but you're starting Pilates as your lower level kind of go-to exercise at the moment. Even if you're not loading too much, you're indirectly affecting your modifiable key risk factors early on for your bone health later on,
Yeah,
without you knowing, through these little things, which I feel like we forget about them, but it's a
yeah,
really key thing.
really important. Yeah, definitely.
Right, I think. Do you have any other questions from your end?
I think we have answered them all.
Yes. So that's it from our end. What I do want you to leave a note is that we will be eventually posting a blog on this. So we'll add, so if you have any questions, I will put some links below in the chat box, because we both have some online programs that can take you from the postnatal period and into later on. So it sets you up later on if you want. So you can have a look at those. But I'll also then once the blog post is up, we'll announce it on both socials, but as well we can put a link underneath the video itself when it's up, and I'll just edit it and I'll just squeeze it in, and it will have all the information that we've just talked about. And if you have more questions, just place them in the comments.
Absolutely.
And
One last thing I was going to say is that if anyone's got any questions, obviously you can ask us, but also go to the which we've already talked about, the Royal Society of Osteoporosis, because they have a wealth of information on there. They've got about
loads of resources.
Associated Osteoporosis. They've got information about menopause and osteoporosis. They've got all sorts of information. So if you have any questions, then head over to there as well.
Yes, I second that as well. I hope you enjoyed it, and I hope we managed to do more. But to help us, just follow us, because we need more than 1,000 followers to be able to do an Instagram live. We figured out today. So yes, I'm sorry we didn't do it live, but we will post this, and I hope you enjoyed it.
Thank
Bye.
you.
Thank you, Katie. Bye.